Hi, this is Dr. Diane Chiu with the Bellevue Laser and Cosmetic Center. Today I'm really excited to talk to you about Voluma. Voluma is the first dermal filler that's been FDA approved specifically to treat the cheek area. It's made by Allergan, who are the makers of Juvéderm and Botox, and it's formulated using something called Vicross technology. This is a technology that provides a very highly concentrated hyaluronic acid dermal filler. What that means is it gives you a lot more lifting power, it gives you longer lasting results, and also gives a lot smoother appearance. The results that I'm getting from Voluma are amazing. They're beautiful, they're soft, they're very natural. We see a lot of lift. Voluma, because it's so tightly cross-linked, doesn't cause water to come into the filler, which causes less swelling, so people don't look puffy afterward. Best of all, Voluma lasts for up to 2 years. In clinical studies, over 75% of patients notice an improvement in their facial appearance 2 years after their last injection. It's totally amazing. Also, because it's made of hyaluronic acid, the safety profile is outstanding. If there's anything you don't like or if there's any problems with the filler, I can use a special enzyme to inject into the filler that will dissolve it right away. So why do cheek fillers at all? Well, as we get older, we lose volume in our face, specifically in the cheek area. So as our cheeks start coming down, you start noticing more hollowing under the eyes, you start to see deepening of your nasolabial folds. It just makes you look older and more tired. So when we put a little filler in the cheeks, what that does is it just restores the apples of your cheeks, lifts up your cheekbones, it'll help with your under eye area, it'll help lift up your nasolabial folds. It's truly a liquid facelift. And Voluma, I've been injecting cheek filler for many years, but Voluma is definitely the most elegant product I've ever injected, and my patients are absolutely loving it. So what I'm hoping to do today is give you a little demonstration of how Voluma works. So follow me. Alright, so here we are with my beautiful model, and we're going to be doing a little Voluma in her cheeks. And what our patient was complaining of is these kind of dark hollows under the eyes, and then just things are just kind of looking a little bit tired. Which is normal when you have kids and you're a busy mom. And so what we're going to do today, I've already numbed her skin for about half an hour with a topical anesthetic, and I've cleaned her off. You're going to get some squeeze balls to hold. It just helps to have something to hold on to. We're going to start with just injecting a little bit here. I'm going to inject a little bit here on the side of the cheek just to lift up her cheeks. So you're going to feel a little pinch, okay? 1, 2, 3, little pinch. And sting a little bit as it goes in. Okay? Voluma has a little bit of anesthetic called lidocaine that's mixed in, so it kind of starts to numb as we go. But we always apply a topical anesthetic too, just so that it feels nice and comfortable. The biggest risk with these fillers is you definitely could get a little bit of bruising at the site and also a little bit of swelling. Doing all right? So what I'm trying to do is just lift up her cheek a little bit. It may be a little bit hard to appreciate in the camera, but just by doing just a few little injections here on the cheekbone, it's already lifted up her nasolabial fold, and it's already lifting up this under eye crease too, the tear trough. So now what I'm going to do is go directly into the cheek. I'm going to feel a pinch. 1, 2, 3. Sorry, it might sting a little as it goes in. Here we go. Okay, open your eyes. How are you feeling? So that's it. We're all done with her injection. We've just injected the other side as well. And she did great. As you can tell, there's really not much. You can't even actually tell that she had anything done. There's really no significant bruising. She can put a little makeup on. We're just going to have her ice a little bit. It's normal to get a little bit of swelling, possibly bruising. Sometimes you don't see bruising until the next day. Usually with Voluma, there's very little swelling though, so she shouldn't have much problem with that. And hopefully these results should last for 2 years. One thing that you might experience right after doing a filler like this is you may feel a little bit of achiness in your cheeks, like when you touch your cheeks, and that's very common, and it may even last for a couple weeks or so, but you shouldn't be able to see it, or it shouldn't feel lumpy at all. And once everything settles down, and all the bruising, if there is any bruising, once that all goes away, you shouldn't even be able to feel any of the product in your face at all. So there are really no other cosmetic procedures that I can think of that can instantly take years off of your face with no downtime at all, and just makes you look completely refreshed and natural. So if you're interested in Voluma, give us a call and set up an appointment.